You will not be discharged until your entire care team is confident that you are ready to return home. Everyone's recovery is an individual process, which is why your team works closely with you to ensure the best possible post-surgery results.
Before being discharged, there is a little bit of a checklist that we go through. Number 1, pain management. Number 2, is the patient able to eat and drink and tolerate what they're eating and drinking without any nausea.
You want to make sure that you're taking your pain medicine correctly, that you're not taking it too much and you're not taking it too little, so that you're still able to move around and do what you need to do. We talk to you about your mobility. We want to make sure that you keep moving at home, and we don't want you doing strenuous activity, but we don't want you going home and sitting on the couch and not doing anything for a week and getting blood clots and pneumonia, which you can also get at home.
When thinking about your discharge, I would think about what would make you comfortable. Even though the medical team, the surgical team may say that you're okay to go home to living independently and by yourself, sometimes patients will feel more comfortable having a friend or family member stay with them. I think that these are things that you should think about and put into place prior to your surgery if you feel that having someone with you overnight for the first few days going home would make you feel comfortable.
We really, I can't emphasize this enough, really endeavor to make sure people are safe to go home. Even though they may not think they are going to be, we've thought about that aspect of it.
We depend on the physical therapist and the nursing staff to evaluate the patient as well, get them up and walking. We have a staircase on CC6 that patients can walk up and down. So once you're cleared by people who have an expertise in that, then you're cleared to go where they deem is appropriate.
This time I won't hold your hand.
Keep in mind that it's important to distinguish between returning home and returning back to what you once did at home. Go slow, and remember, you still have steps in your recovery.
You shouldn't be doing any bending or lifting or twisting. Don't pick up anything that's too heavy. Your surgeon will let you know exactly how much. Usually it's 10 pounds. No driving until you stop taking pain medicine. Your surgeon has cleared you to drive, which is usually at least a couple of weeks. You shouldn't drink if you're taking narcotics. The pain medicine can impair your judgment, and if you add alcohol on top of that, it can be very dangerous. So you could end up having falls at home or end up with other issues that you don't want.
You'll follow up usually around 2 to 3 weeks after your initial surgery, and then normally around 6 to 8 weeks or so, depending on the type of surgery that you had.
One thing that patients can keep in mind is that not to compare themselves to their neighbor, to their friend, that everyone has a different situation, different recovery, and we tailor their surgery, of course, and their post-op care to their specific situations.